Hi and welcome back. Have you ever gotten a medical bill in the mail and thought, wow, this is a lot. How am I going to pay for it? Well, this video is for you. In this video, we're going to be covering financial assistance programs in nonprofit hospitals and kind of give you an FAQ all about it. All right, so one thing that not a lot of people know is that most nonprofit hospitals have financial assistance programs, sometimes called charity care, and a lot of people qualify for it. But it's not something that is generally advertised when people go about and get these bills. So we're going to walk through what these programs are, how to find them, do they work with insurance, and some questions that you might not even thought that you could ask. Basically, you're not alone when it comes to medical bills being really overwhelming, and I'm just here to give you some resources. So, what is financial assistance? Nonprofit hospitals are supposed to have some sort of sliding scale discount program or, a waiver to exclude medical bills that would be considered a financial hardship for its patients. Also, fun fact is that the majority of hospitals in the United States are considered nonprofit. So those that are religious or secular or community-based are commonly nonprofit ones, meaning that you likely have had services or going to get service by a nonprofit hospital, meaning that there is probably some type of charity care, sometimes it's called, or financial assistance program available for you. So what does this financial charity care look like? It could be full bill forgiveness, it could be a partial discount, it could be more favorable terms for payment plans. So you might qualify for like a discount and then you can extend the payments of the remaining balance for longer than what you would have if you were just trying to do a normal payment plan. There's something called income-based adjustments, so you could get a sliding scale on individual services based off of the income you have. There is just a lot of different nuances to these different programs, but just so you know, they are available and they will do this thing, which is lower your medical bill. Another key thing is that in most cases, it's not automatically applied. So these are things that you have to ask for in order to enroll, so that way you can benefit from the program. So you might be thinking like, well, if I make not a lot of money and they already know that, why can't they just do it? Well, it's because they don't know that. You would have to supply that information to them in order for them to make the determination whether or not you qualify. So how do you find out if you qualify? Well, the first thing you have to do is find out about the program. You could do that by looking for it online because they are required to have the policies published, and then you can read it. In some cases, the hospital is really cool and it's like not a lot. In other cases, it's like pages and pages long, but their general is how you can find it. But you can also just call and ask for the billing department and then ask them, hey, could you please point me information towards the financial assistance program or the charity care? Do you offer that? Can you send me an application? And that generally will start the process. Can you use it if you have health insurance? Yeah, you totally can. And I think that's a very common myth in which people go, oh, well, my medical care is already discounted because I use insurance. It is kind of, sort of, if you really know how medical insurance works when it comes to, hospitals and billing and CPT codes and all of that fun stuff. But yes, you can still use it even if you have insurance. So in my case, with my hospital bill after delivering my son, I got the remainder of what I was responsible after they had charged my insurance. And then I went in and applied for financial assistance to say, hey, this amount is still too much for me at this time. Just so you know, it can apply towards deductibles, co-insurance, basically the out-of-pocket expense. Generally, it is they bill your insurance first, and then that total balance at the end is where they do the discounts. But it is still something to consider, especially if that bill is going to cause you financial strain, even on a payment plan. So those are things that you can look into and understand that it's available to you as an option. So let's walk through some common questions that people have asked me when I mention that this is something that I have helped people with and that I have done myself. Who qualifies? Well, for the most part, most programs are based off of household income as well as the household size, and it's all based off of usually a percentage of FPL, which is the federal poverty line. So a lot of people will already automatically assume that means that you have to be in poverty to qualify. But actually, in most cases, there is a sliding scale of discounts. And in some hospitals, it can go up to 400%, which is actually like, middle class in most cases, dependent again on the household. Do I have to be low income? Well, like I said before, no, not necessarily. Again, it's based off of income and your household size. So the more kids you have, the more wiggle room you have in terms of how much income you can generate. But also, it's usually a percentage of federal poverty line. So 400% would be 4 times whatever the federal poverty line is at your location. In the most cases, like the continuous 48 states have one federal poverty line, and then there's a different one for Alaska and Hawaii. Can you apply after getting the bill? Yes, generally this is what people do. They apply after they get the bill. How far back can it apply? So in most cases, it's retroactive, and sometimes it's for a whole calendar year. So if you apply for one medical debt that's, end of the year or middle of the year, it might retroactively apply to the beginning, so January. And so any other things you had, they may then discount, and you'll get like a check in the mail for extra payment that you made. So that's really cool and something that a lot of people don't necessarily know about. But you do need to check the policy guidelines because it does vary across different hospitals. In some cases, you have up to 12 months. In some cases, it could be a year and a half. It also depends on when these claims were filed and then how far retroactive or how long you have after you're approved. How long is it considered still relevant? So again, those are things that are more outlined in the policy guidelines and something that you would have to check when you apply, because I don't know the policies for every hospital. What documents do they ask for? In most cases, what they'll ask for is a tax return, some pay stubs. Sometimes they'll ask for income verification forms, so that's something that your employer would fill out. Now, what if you are self-employed? Well, I'm self-employed, and so aside from my tax returns, I provided my bank statements to show when I was paid, what were my expenses towards my business, and then just kind of gave them like a midday line of like, hey, this is what I made so far in the year. And also I was on maternity leave, so I didn't work, therefore I didn't get paid for a couple of months. So you have to base the numbers on what I currently have. Another thing is sometimes they can go based off of averages. So you would just give them a whole lot of paperwork and then they would calculate your average per month, and then that will be how they generate your total for the year. There's also times where they'll ask for alternative proofs. So there may be a case where they'll take your profit and loss statements. There's sometimes where, like I said, they'll take your bank statements. There's other ways to go about it. Again, it's based off of the hospital's policies, and they'll tell you what they want and what they don't want. So what does it cover? In most cases, it covers services that were done in a hospital. So think like ER visits, think like an actual hospital stay, surgeries done in the hospital. In a couple of cases, it can be done for certain outpatient like surgeries if it's affiliated with the hospital. And then you could think like blood work, lab work, MRI, scans, like medical services, but generally it's what was done within the hospital. Also, so you know, you do have to pay attention because sometimes you will be billed separately for the physicians. And so if that's the case, it may not apply in that financial assistance. The guidelines will usually spell out what they do count, what they don't count. And so again, it's things that you have to just pay attention to. So how do you follow up? Generally, I want you to think of it as a process, okay? Because this is something that you do want to follow, especially if it's a lot of money that could potentially be forgiven. You want to make sure that you call, you want to make sure that you document who you spoke to, when you spoke with them, what did they roughly say. Some hospitals have it where it's like in a portal online, so you could like email them the document, scan it. Other places you have to fax it, in which case make sure you keep the fax cover sheet that says whether or not it went through and when. Some places you have to do it through the mail, in which case I always recommend if you're doing it through the mail, make sure that you pay for there to be a signature, so that way you can confirm that it was delivered and they did receive it, and then you have that for when you call up to find out more information. And you can be like, hi, based off of my mail carrier's, tracking number, it says that you received it. It was signed by so-and-so. It's been X amount of time since then. Could I please get an update on my financial assistance application? What do you do if you're denied? So if you're denied, you still have options. I was denied for my son's birth, and I immediately went to work to ensure that they were calculating it correctly and not based off of previous years, because again, I was going to be on maternity leave, so I wasn't working, I wasn't making money. So what you do is you can ask about appeals. You can ask to see if they have something called partial discounts, which in some places they do. You can ask for a hardship review, in which case you can mention that there are additional circumstances, maybe job loss, maybe temporary, you're not working. Those are considerations. Another consideration that not a lot of people think about is whether or not you have more medical bills, because the higher amount of medical bills you have, generally they will include that too in the consideration of how much money do you actually have compared to like things that you're responsible for already paying or being already on a payment plan. Again, most of the times it's mostly your medical debt that's not just what from the hospital. So in my case, like the bills for like all my OBG appointments and stuff, that they asked for that. So that's just something to consider. Another thing too is you can also ask again about payment plans, because in some cases hospitals will have favorable terms where they could extend the amount of months. So instead of like a payment plan of like 5 years, there may be one that's like 6, 7, 8, which would lower the payments. And generally when it comes to medical debt repayments, most cases, the interest rate is 0%, so it's an interest-free loan. Lastly, the one other tip I can consider is to make sure that you ask whether or not you can reapply if your financial situation changes, and again, ask about how long do they have from that original claim to file. So that could protect you in case later down the line you go back to work or you have more further complications and then you end up working less time, etc., and your income gets more variable. You would have the information already and they would already have like a starting case for you. Another question that people commonly ask me, whether or not it will affect your credit score, and the answer is no, it doesn't affect your credit, although there are some instances where they may ask for your credit. Again, it depends on the hospital, but most cases they don't. Also, another consideration is that many hospitals commonly will pause their debt from sending it to collections. And sometimes if you're already on a payment plan, they'll even pause those payments while they do all that reviewing. But make sure you confirm that, talk to them and ask them like, hey, I am not unable to pay this amount. Is it possible to look into financial assistance? And while I am waiting on the approval or the denial, basically while I'm waiting on the review, is it possible to pause these payments? Or if there is a way to slightly lower it and then go back, dependent on what the review says. Again, it's something that might be worth asking. If a bill is in collection, sometimes too, you can call and get it back. Again, this is something that you need to call and find out from that hospital what their policies are and whether or not once it moves to collections, if it makes it ineligible for it to be put back on financial assistance, or if it makes it eligible and they could pull it back. So here are some questions that a lot of people don't realize they can ask when they are calling about this program. Can this apply to past bills? Will you pause billing while this application is being reviewed? Can you help me fill out the application? How long does approval last for? Am I able to reapply next year? Another thing that not a lot of people know is that there are financial liaisons, there are ombudsmen available to help with this process. You just have to ask about it. I really want you to remember that medical billing is complicated. It is nothing you did to not know about this, or there's nothing that you did wrong, and that it's not necessarily a bad thing that you might consider these options, okay? It's just a program that is available. It's a program that is made available to help people. It's just that people don't often know about it. Last thing, asking questions doesn't make you difficult. It makes you informed. I know a lot of people get really afraid of asking questions or feeling stupid about it, and that's not the case. They are trained to try to help you. And so asking questions just shows that you are an informed person who is trying to make sure that everything is going to your benefit. So don't take it as just like they're going to hate you or they're going to like be mean to you. Most cases they don't. Please though, when you ask, use a nice tone though. That helps. No one wants to be yelled at on the other side of the phone. So yeah. Financial assistance programs aren't generally explained clearly. Hopefully this video helped you and gave you some information about them. Again, this is just general information, but There is a cheat sheet in my Unmuted Money School community related to this video. So if you would like that, check out the community. There you can find it. Again, I'm there. If you want to ask questions, feel free to ask questions. More than happy to help, or just like look through it with you and then highlight some things that might be pertinent to you. I have experience doing this. I've done it for myself. I've done it for other clients. It's just something that I think should be talked about, and it isn't, and so hence this video. Now, I'm actually making a part 2 video, and that's going to be covering the common mistakes that I see when people are applying. So that should be something that is helpful for you in case you are considering it, so that way you end up saving time. And trust me, sometimes it can be a headache and can be months. So let's try to get it on like the best foot. So yeah, I'll see you in the next video, and bye.